Board of Integrative Medicine defines it by 4 points. The first point is it reaffirms the importance of the relationship between the patient and the physician. It focuses on the whole person, mind, body, and spirit. Is informed by evidence. Okay, so everything that we prescribe, we have evidence to back it up, which is important. And it makes use of all therapeutic approaches, conventional and alternative, to achieve optimal health and healing. And the rest of the lecture, I'm going to define each of these points and how it relates to my practice. This is a picture of Dr. Andrew Weil and myself at graduation. I did a 2-year fellowship at the University of Arizona, and in January was graduation. And he presented each of us, there was 50 of us, an agave stick. This is a walking stick to symbolize us moving forward in our career. So it was a really special time. He's the founder of Integrative Medicine, and he started his program at the University of Arizona in 2000. And since, he has trained over 1,000 medical doctors for integrative medicine. Okay, this says we're in a man gulch, and I took this analogy from a documentary that I would recommend. It's called Escape Fire. And in the beginning of the documentary, it explains how there was a really devastating fire in Man Gulch, Montana in 1949. And what happened was they sent in 15 fire jumpers to this massive fire. And unexpectedly, winds picked up. And so these firefighters were in trouble, and they began to flee. And one of them, with the remaining fuel he had, drew a line in the grass. And so the fire consumed that fuel, and he created an escape fire. So the analogy is that in medicine, in our broken current healthcare system, we have the answers, but sometimes we either don't want to believe it or don't want to change our lifestyle. Because as a result, he was the only one to survive that fire. All the other firefighters perished. So he knew the answer and he survived. So it's the analogy of our broken healthcare system, and how we have to change our lifestyle and focus on prevention in order to change the healthcare system. Some facts about where we are in this country in healthcare. Some pretty shocking facts here. 75% of medical care currently is for preventable chronic disease. So what's chronic disease? Diabetes, hypertension, cholesterol, heart disease, obesity. There's an obesity epidemic in this country. 1 in 3 Americans are obese. 2 in 3 are either obese or overweight, which is really astounding. Type 2 diabetes affects 8.3% of the U.S. population, and this is climbing. There's an expected drop in life expectancy for our children. It's most likely that our children are going to live shorter lifespans than we do. And the U.S. is ranked 16th of the 16 most industrialized countries and 50th overall regarding life expectancy. There's a list. There's Cambodia, and then there's United States. So something has to change. It's not sustainable, our healthcare system, and our children are going to live shorter than we are. So I'm hopeful that integrative medicine is the way of the future, and that will create this movement and this change. And the last bolded point here is the U.S. spends almost twice as much in healthcare than any other country, and you see where we are. We're 16th of industrialized, and we're 50th, and we spend almost twice as much. So this is not a good situation. Okay, this is a quote from Francis Peabody that I thought was appropriate. Now, Dr. Peabody was a physician at Harvard in the 1940s. He taught there, and he said this quote at the end of one of his speeches that he was giving to the graduating class at Harvard. And he said, "The secret of the care of the patient is in caring for the patient." So my belief is that physicians are inherently caring people. I know a lot of them. I'm married to one. I really do believe they're good people. However, I think the system is bad, okay? And that, I think, is the problem in this country. As Susan was saying, I used to see 25 patients a day. So that boils down to like 10 minutes with the patient. So I felt that I wasn't giving good care because I didn't have the time. And so I think it's a backward system where our health is paramount. We give it the littlest time. And if it's really not because of the physician, I truly believe that. I think it's because of the system, the model that we're in. And so in integrative medicine and in my new practice, I'm trying to change the model to give better care, more comprehensive care. You can call it more holistic care. The new field is integrative medicine. So I want to explain now what the integrative medicine plan looks like and all the pieces that I go into with each of my patients. We focus on nutrition. That's number one. We use food as medicine. Okay, that's quoting Hippocrates. Let food be thy medicine. So I have an intake form. It's pretty in-depth that they tell me their diet even before I meet them. And then we go over it together and we use food as medicine when appropriate. Sleep is so important for our overall health, our emotional health, our physical health. So we talk about sleep. What are the barriers that you're not getting restorative sleep? Is it your partner in bed? Is it your bladder? Is it your hot flashes? And then how do we rectify this? We talk about sleep hygiene. I use nutritional herbal supplements when needed. Exercise or movement increases natural endorphins, good for our mental health, good for our physical health, reduces blood pressure, cholesterol, sugar. Mind body, okay, there's a whole field of mind body medicine, which is part of integrative medicine, and it really explores how the mind affects the body and how we can control some bodily functions by our mental outlook, positive thinking, the mind-body connection. Spirituality, I ask everybody, do they have faith, or where do they find meaning? That's another way to define spirituality. Treating the whole, mind, body, spirit. Environment, I talk about toxins. So there's three major ways we get toxins. We ingest toxins, and that is what we breathe, as you know, cigarettes and exhaust and mold, things. What we ingest, so I talk about pesticides and herbicides and organic when necessary, and what we absorb through our skin. So for women, I ask them in the intake form, what cosmetics do you use, what detergents do you use, household products, and I just try to lessen the overall burden of toxins because this is a toxic world. Connection, that means are you connected in the community, with your church? Do you have a support group? This is social connections, relationships with people. Because, if we lived on an island and we were eating well, all organic, we were swimming to catch our fish, we were getting our exercise, we were sleeping so well because nobody's bothering us and it's quiet and peaceful, but we were alone, I don't think we'd be well. And there was a couple movies about this, illustrating that. So that's the connection piece. Are you connected? Okay, conventional treatment. So I am traditionally trained as well as alternatively trained. So I do write prescriptions when needed. However, I've written less and less with this new practice. But integrative is not alternative. It's integrative. So it blends both worlds. Okay, it doesn't discount one, but it just believes there's so much more we can do than just prescriptions. And then other, I put manual medicine. That means massage, chiropractic, osteopathy. I don't do that myself, but I can make referrals if I think it fits. Herbal medicines and vitamin supplementation, which I do. So now I'm going to go over the 4 points according to the American Board of Integrative Medicine, according to their definition, and tell you how my practice correlates with that. As far as reaffirming the importance of the relationship, I do spend 1 to 2 hours with patients. I have the luxury of time, which I really feel that is the key. So my first consult, I put on my website it's 90 minutes, but truly it's more like 2 hours. But like today it happened, but that's okay because I have the luxury of time, and if you need more time, you need more time. So we try to schedule that give us some leeway. Follow-ups are usually an hour. I wanted my office to be warm and home-like because I feel that setting really plays a role emotionally on the person. So as soon as they, walk through our path, I want them to have a good experience. There's been evidence that, when we look at a beautiful scenery or beautiful photo, we release natural endorphins, so we're feeling good already. So I worked hard to make a really warm, lovely environment for the patients. We have a patient portal system, so this means that they can communicate with us, whenever, electronically. This is an electronic system, so I want to be there for the patients and directly communicate with me electronically or the phone. So I pick up the phone all the time, and people are shocked. But this is how it used to be, right? This is how it used to be, and I think we need to go back a little bit, less of a business, and more personalized care, personal care. I'm a solo practitioner. That's rare these days. So it's great because it's me and you. So it's fun, and we build a relationship, and there's that continuity of care versus you just see who you can see that day or whatever. Focus is on the whole person. So this goes back to the mind, body, spirit. I do biofeedback in the office, and biofeedback really by definition is training yourself to control involuntary processes for health benefit. So that's a lot of words, but basically by breathing, by positive thoughts, we could lower your blood pressure and decrease anxiety. That's an example. Biofeedback. Breath work, the same kind of thing. We increase the parasympathetic nervous system, decrease the sympathetic, which is our flight and fight response, through breath work. Prayer. I'm a believer in prayer. I pray with my patients. I think this is a great added thing to do. Meditation. I always ask in my intake form, what do you do for stress reduction? What's your stress reduction? Do you meditate? Do you exercise? Exercise, stress reduction. Yoga, mindfulness, and just a little piece on meditation. When I first, studied integrative medicine, they talked about meditation. I was always kind of daunted by that word because I always thought it meant that you needed to transcend to this other place. However, I've learned that meditation or mindfulness doesn't necessarily mean going to another place. It just means being completely aware of where you currently are. So it's that engagement with a person, that you're there. You're not focused on the kids' homework and the dinner and the laundry. It's you are present in the moment. Okay, so that could be a form of meditation, mindfulness. And there's studies, and there's Dean Ornish. She's a cardiologist, a pioneer in alternative medicine. He did a big study about exercise, meditation, and a whole foods diet, and he showed how it reversed heart disease. So this is evidence-based. This isn't just sound pretty and fluffy. This stuff works, and so it's a part of my program here. Okay, is informed by evidence. So integrative medicine is a new field as of 2000. There is a board, and we're going to sit for the first board exam ever. So in the fall, I'll take the board and hopefully be board certified in integrative medicine. And even in order to put that label on my sign or call myself that, now the laws have changed that the physician needs to go through a fellowship, because there's some people out there who say they're integrative, but we want to make sure it's regulated as far as the schooling and the training. So now there is some regulation, which is good, I think, for the field. And there's 21 fellowship programs approved by the American Board of Integrative Medicine. So it is a growing field, and I'm very grateful and hopeful for that. Makes use of all therapeutic modalities. I want to go into a little bit of details why my practice is different, even more so than I already did. So, as far as nutrition, I have a health coach that works with me. She is a nutritionist health coach. So my first consultation, is an hour and a half to 2 hours with me, and then at a later time, it's like a complimentary visit. It's not mandatory, but it's there included in the fee that they meet with her as well, and she can fine-tune your nutrition. She can go food shopping with you. She's walked the track with some patients, so that's a great benefit. And I do some neat testing. I do some, this is a new test I'm doing, DNA testing for weight loss. What this does is it's a single saliva sample, and then we send that, we FedEx that sample to San Diego, and it looks at your DNA as far as how you break down major food groups. So it looks at how you metabolize fats, how you metabolize carbs, and protein. And as a result, if you're a slow metabolizer of carbs, then it's recommended, well, you should be on a low carb diet. Your pie chart changes. So instead of like a balanced diet is considered 50 to 55% of carbohydrates. I mean, that's our main fuel source. We need carbohydrates. However, if you were a slow metabolizer of carbs, then your pie chart would be 40% carbs. Okay? So this is really revolutionary. This test, I love it. It looks at your exercise response, which is really cool. As far as cholesterol benefit, insulin sensitivity. In my old practice, we checked cholesterol, and their cholesterol wasn't favorable. And I'd say, well, you need to eat right, but I didn't have time to tell them to eat right. And you need to exercise. And some people took that to heart, and they really exercised. Maybe they even came to fitness together. And they came back, and I rechecked their levels, and they were the same. Well, it could be a genetic component, and this DNA test looks at that component as well. It looks at your nutritional needs. What else does this one sample show? Oh, even how you respond to certain medications. If ever you were to be put on a medication, it looks at how you metabolize that med. So we can, it gives you more insight, really, how your body is, your predisposition, we'll say. Okay, I also do a pretty elaborate vitamin and mineral assessment through blood work and urine, as far as nutrition goes. Okay, hormonal balance. I'm big on hormonal balance. Thyroid. I check a lot of thyroid levels, not just the TSH screening level that traditional medicine has trained us in. We can look further, so I do that. I look at your adrenal function and reproductive hormones, like for women, estrogen and testosterone for men and women. Digestive health, which is a big new field, which is very exciting. I do a lot of this. I send for a complete diagnostic stool analysis. It looks for good and bad bacteria. It looks for parasites. It looks for inflammation. It looks for your digestive enzymes. So this is really revolutionary. It's becoming more mainstream, even the stool analysis. And I have those kits in the office, and I provide that when it's appropriate. I do food allergy testing. And so, moving on, stress reduction, which we already talked about. What I do personally is the biofeedback and the breath work. Natural supplements. So I studied the supplements that were clinically tested, that are effective, the right dose, and how you prescribe it and when it's appropriate. So there's very good evidence for natural supplementation for certain illnesses. And then I do, as I said before, I prescribe medicine when it's necessary. The last slide speaks of the future of integrative medicine. So there's a consortium of academic health centers of integrative medicine that was founded in the year 2000. And their mission is to advance the principles and practices of integrated healthcare within academic institutions. And currently, there's 57 international academic members, including Harvard and Stanford. So this is very good. This is very good for the field. And my hope is that this will continue to grow and flourish, and we'll be a better country for it.